So if I could invite everyone at this point in time, please, to mute your microphones if you have not done so already. I would like you to note that we are using the Skype for Business chat. So at any time during our presentation, if you've got a particular question or a comment that you'd like to make, please feel free to type into the chat. Throughout the webinar today, we do have a number of times when we will stop together and we'll stop together in order to take questions. So I would invite you to use the chat for that purpose. So I think we've waited long enough. My name's Andrew Brown, and I'm Workforce Development Specialist working for GHS PSM. And I would like to thank you all for coming to the presentation that we have before you, which is the Workforce Development presentation focusing on capacity development is not training. So what is it then? We have some people joining by phone and some people joining via the web. I'd also like to introduce to you, sorry, I'm just having a moment here while I'm just organizing this screen, which I will share with you. We were hoping to take some notes of people who's coming on the call. So we've had a series of webinars on a range of topics with workforce development, and we've got our next one in our series for you today. Health supply chain management capacity development is not training, so what is it then? I'd also like to introduce to you Michael Egorevba, who is a workforce development specialist working with me, and we will be sharing this particular call together. What we are going to do today is to take you on a journey to do two main things. One is to explain why there is a need to systematically improve human resources capacity, as well as to introduce to you or reintroduce to you the people that deliver theory of change for supply chain management as a way to systematically understand capacity development of workforce. We often think of capacity development as training, but that's only part of the picture. And we hope that you will leave this webinar today with a much more systematic understanding of capacity development and with some tools and approaches that you can incorporate in the organizations you work. There are 4 parts to today's webinar. I'll shortly hand over to Michael, and Michael will be leading us through these first 2 sections. Why, what is the need for a focus on human resources capacity development in health supply chains? And also to introduce to you our project, which a lot of you are aware of, but we want to outline what we are doing in this regard and then come back to give you a systematic introduction to capacity development through the lens of the people that deliver theory of change for human resources in health supply chains. And I want to also talk to you about a country application in Rwanda. As I've mentioned, if you've joined the call, again, you're very welcome. Please take the opportunity to type in your name, your organization, the country you're working in, and the position that you have, and that will allow us to see who's on the call. And with that, I would like to now hand over to Michael for the next part of our presentation. Thank you, Michael.
Thank you, Andrew. I welcome everyone to the webinar. Next slide. While look at the overview, we need to know the need for a focus. Okay, next slide. Okay. The current challenges facing the health supply chain today, mostly in the middle and low income countries, include the use of unqualified and disempowered staff to manage the enormous responsibility of a public health supply chain. And the result is obvious. We see this on a daily basis. Poor availability of health commodities, wastage of resources from expiries, and poor health outcome, such as high maternal mortality rates. And if you look at the popular quote of Professor Saracino, which says, when you use a nurse or a physician as a logistician, you lose the nurse or a physician, and you don't have a good logistician. So in the end, you don't have a good logistician, you don't have a good physician, you don't have a good nurse. And the outcome from low and middle income countries are usually poor health outcome. Next slide. So there are several issues facing the supply chain workforce today, and they range from fragmented responsibility to manage the overall performance of supply chain, and also given. Okay, can you mute? There are some noises coming from the background. Just mute, and if you have any comment, you can type in. So a good example is giving enormous responsibility to the workforce in supply chain without the attendant authority to do the task. It's equally within that fragmented responsibility. To the lack of professional development and lack of professional association. Other challenges that issues that they face include lack of planning for supply chain workforce, lack of development and credentialing for supply chain managers, and lack of accurate job description. Next slide. So the workload and the work pressure and responsibilities of the supply chain workforce will continue to increase. Year by year, it will definitely continue to increase. We've seen that over the years. A good example is in Chad 2010, the workload of vaccines supply chain increased by 5-fold, with a corresponding 24-fold increase in value. This is just vaccines. So the same is being experienced in HIV/AIDS commodities, malaria commodities, essential health commodities. So the workload will continue to increase, folks. And what are we doing with respect to the workforce that is managing the workload? Next slide. As Andrew said, here we're introducing to you can you mute?
Just one moment, Michael, I'll just check. Yep, great. That's been fixed.
Okay, thank you. So the USAID Global Health Supply Chain Procurement and Supply Management Project, for short, we call it GHSC PSM, work with country partners and suppliers worldwide to make health commodities available all the time. And the essence is to promote health and to save lives. Next slide. The project does this by providing technical assistance to partner countries and pursuing policy change to workforce development and capacity building. And this has been demonstrated in Burma, Ethiopia, Guyana, and Zambia. Next slide. So the project's health system strengthening vision is to see that all government-led supply chain are integrated, optimized, lean, and sustainable. We are talking about systems with automated data capture, real-time and end-to-end visibility, pharmaceutical-grade infrastructure, and efficient distribution that is managed by supply chain professionals in a culture of quality improvement. Next slide. So where are we going with this? The ultimate outcome of the workforce that the project wants to see are the workforce that comprises of strong professionals who assume end-to-end responsibility for the performance of their country's health supply chain. And they are supported by policies, adequate policies and procedures to retain them. Next slide. So we are looking forward to a health supply chain workforce that has matured from the foundation phase to the far right, which is the advanced phase, that will assume end-to-end responsibility and can manage change, because there's so many things that are happening in the supply chain field, and we want to get to that matured phase, and we want to have supply chain workers, that can manage the changes that are going to be coming up as you move from one phase to the other. Please type in your questions and your comments. At this point, I'll hand over to Andrew now.
Thank you, Michael. That was a great introduction that is setting the scene for us in terms of why we're focusing on human resources and what we as a project are looking at. I would like you in the chat, if you've got any particular questions regarding this introductory section of the webinar, please to let us know. We will be making the slides and the recording available for anyone to look at afterwards. Elias notes that a lack of motivation is also one of the major challenges. Elias, I think you may have seen my slide coming up shortly, where we look at these other challenges as well. So those on the call, you may wish to also share some of the challenges in human resources capacity development that you're also experiencing for others to see. So now what I'd like to do is to move on to think about what does a systematic approach to workforce development look like? We're saying that capacity development is not training, so what is it then? And I want to take the time to show you a couple of high-level points to consider, and then to also narrow down onto this particular framework that we're using, which is the People That Deliver theory of change for health supply chain management. Many of you on this call will have seen this particular framework from WHO that looks at the variety of building blocks that build and make a health system. And system strengthening requires all of these building blocks to be worked on together in order to make change happen. Now, medical products lives in here. You can't see anywhere health supply chain listed, but for medical products to get from the manufacturer to the patient, we have the health supply chain. And on the screen now is a very popular picture that represents all the different aspects of the health supply chain. And as Michael noted, it's not just the technical competencies that staff need who are looking after medicines in the supply chain, but also leadership, change management, and other soft skills. And here you will see that there is a whole range of areas that make up the supply chain. And at the middle is organization and staffing, which also includes supervision. And as we'll see shortly, also motivation, skills, and working conditions. But the take-home message is that system strengthening of a health system has many components. A supply chain is one of them. People often say that a good supply chain's superpower is its invisibility, but its ability to provide medicines available. And for that to happen, you need a strong workforce. But for quite a while, we've been focusing on just looking at the skills of that workforce and not other HR components. On the screen is a paradigm that we are aiming to have. Wouldn't it be great if we had an elevated status for supply chain workforce so that we actually hired qualified staff to do supply chain functions, that there were career incentives for those staff to stay engaged in health supply chain management over time, that there was high staff satisfaction and retention, that supply chain jobs were actually desirable, that qualifications were sought, and that particular institutions actually provided a great supply of relevant and work-ready personnel for working in supply chains. One of the problems with human resources is if you put donors in a room and say, who wants to look after the development of the human resources, often no one will put their hand up because people see training as a waste. They've seen investments over the years without improvements. One of the issues with human resources is we need to understand it's a long-term focus. It requires reform in policies and practices. It does require a consideration of converting what may be considered as expenditure into investment in the workforce. Some of you on the call will be familiar with the World Bank report that came out in 2017, noting that $1 invested in health workforce in the health system gives a 7-fold return on investment in terms of productivity. Capacity benefits accumulate over time. And so if we are serious about systematically improving human resources in health supply chains, then we need to have this focus. A number of you will be very familiar with People That Deliver, and we have representatives from that organization on the call. You're very welcome. People That Deliver is a global collaboration of partners working together to try and improve the professionalization and systematic approaches to the workforce involved in health supply chain. And the vision that they have is that this world will have a supply chain workforce empowered, equipped and optimized to ensure that health commodities are available to ultimately improve health outcomes. Just in passing, you can go to their website, but these are the range of organizations that are on the People That Deliver board, and a number of you are from those organizations on this call. But one of the key frameworks that was released last year is this one. The theory of change for human resources in health supply chain management. Now, theory of change describes, it's a research approach or a social science approach that describes complex problems. It describes these problems in a way that helps you understand what change needs to occur if you're going to fix that problem. It helps you to understand the various complexities. And it does so in a way that thinks you through from an ultimate outcome to think about the actual actions you need to take in a country. So I want to walk you through this theory of change so that you can see that capacity development is not just training. So this is a section of the theory of change. And basically, we have these areas here that are called pathways. Those pathways link together a series of events that need to be present if you want a desired outcome to take place. Now, in this situation, we've noted that we do want to have health outcomes improved, but we know that apart from medicine supply, there are many other aspects involved in that, and we don't have control over that. This next one down is that commodities are available at service delivery points to meet needs in the most cost-effective way. We know that human resources are only one component of that. So although we're aiming to influence that, there are many components. So what can we influence? What we can influence is we can optimize work performance. And in understanding how to optimize work performance, we can understand 4 key pathways that are necessary in order for this to be achieved. And it's much more than just training. As background, on the People That Deliver website, there is a outcome diagram that will give this in a lot more detail. I'm shortly going to give you an overview. There's also a narrative that gives you some written explanation, including a number of enabling factors or precursors that need to be in place for change to happen. And there is also a series of indicators and interventions. So this is the complete theory of change, we can look at in more detail. In this webinar, I want to think about these core pathways and help us to understand if we're saying capacity development is not training, then what is it then? So far we understand that there is a change that we want to enact. And in this situation, we want to improve and optimize the performance of staff working in the health supply chains. We need to understand how that change is going to occur. And then what we need to do is to think about the interventions that we want to invest in that will contribute to that improved work performance. There's no point contributing to interventions that are not going to affect your ultimate outcome. And then it's also important that if we're only investing in one particular part of the human resources development, then overall we will still not get optimal performance. So let's look at those items together. So on the screen now, you'll see a summarized version of the theory of change, and it has 4 pathways. These are 4 aspects that need to be present within the human resources systems of an organization, within a country context, in order for workforce performance to be optimized. We need staffing, skills, good working conditions, and motivation. So Elias, here you go. Motivation is here. And this is all founded on the principle that the importance of supply chain is acknowledged throughout the health system and positioned accordingly. In many countries we work in, health supply chain is not spoken about in the Ministry of Health at the executive level, and this is a conversation that needs to happen in order for supply chain to be taken seriously. So where supply chain is taken seriously, organizations within country contexts will be looking at improving human resources in supply chain in a more systematic way. The ultimate goal we mentioned was these health outcomes are improved and commodities available. Again, we can influence this partially, but there are many other factors. This long-term outcome is what we're seeking to influence, workforce performance. And what we know is that workforce performance is not just skills development only. There are staffing, skills, working conditions, and motivation. So let's look at those in a little bit more detail. The ultimate goal, again, we're all talking about what's the link between universal health coverage and supply chain. What's the link between improved health outcomes and supply chain? Basically, if products are not available, then the health services cannot be delivered. The long-term outcome we're looking for is workforce performance is optimized. A workforce must be in place and performing optimally in order for commodities to be available in the most cost-effective way possible. So let's look in detail now about what needs to be in place to contribute to this goal. 4 pathways: staffing, skills, working conditions, and motivation. What I haven't told you is the background to this is a range of research activities over a number of years, coordinated through the People That Deliver initiative, looking in real live environments in a variety of countries that have come up with this particular model. So this is not theory, it's based in practice to help us understand this complex problem of improving performance. So the 4 pathways is what needs to happen for the long-term outcome to occur. So workforce performance is optimized through these 4 distinct mapped pathways. To reach the long-term outcome, all of these areas must be in place. So again, if we're just concentrating on skills, then we're only dealing with part of the problem. For staffing, are all the critical supply chain positions and all competencies filled? For skills, do all the staff apply their skills as appropriate at every level of the supply chain? Do working conditions support performance? And workers are motivated to do their jobs. Are these 4 things happening within the health supply chains that you're working in? If not, you are not optimizing workforce performance, and we need to be looking at how to strengthen these particular pathways. What this particular slide shows is where a lot of us are focusing on short-term skills development or pre-service skills development. If we're only focusing on skills development, then we've missed 75% of what's needed for good performance. A reminder, all 4 of these pathways need to be present for workforce to be optimized. So let's take a few moments to look at each of these in detail to see a couple of the elements. Again, I'll remind you that in this presentation today, we're giving you an overview, a summary of the pathways. The documents that are available through the People That Deliver website explain these elements in more detail and also give you ideas on particular activities that you can invest in organizational situations in order to improve these pathways. So for staffing, you need to be able to have the ability to recruit quality candidates. You need to have an adequate pool of workers, and you need to have sufficient budget to employ them. Skills. Staff need to have adequate technical and managerial competencies. They need to have leadership skills. They need to understand their roles and responsibilities and how they fit into their environment. Again, a lot of our short-term technical assistance is in this area, but only focusing on perhaps one of those subsets. Working conditions. This is probably one of the under-thought-through areas within our workforce in health supply chain. Have we created a favorable social and emotional environment? Or is the environment overworked, overpressured? Is the physical environment safe, clean, and conducive to performance? Is there adequate lunch facilities, bathroom facilities? For female workers, is there sufficient flexibility for them to be able to bring children to work to breastfeed? Do we think carefully about the security of our staff members, whether male or female, as part of the role they play? And also with working conditions, do staff members have up-to-date and relevant tools and equipment to do their job properly? If these things are not present, then workforce performance is not optimized. The fourth pathway is motivation. This is Elias's key point before. Is good performance supported? And in the same way, do workers have a sense of ownership in their role? And do workers understand and care about the role in the healthcare system? And underneath these three, there are other elements. These are three main ones. But not only is good performance supported, but is also bad performance corrected? And that's also a particular area of this pathway that is under-focused. So we're back to this summary picture, and a reminder that all four of these pathways must be approached in parallel if you want to achieve successful change and have the outcome we're aiming for, which is that we have an optimized workforce. So, for example, skills are essential to workforce performance, so I'm not saying that we should not do training, and they may be fostered by training. However, skills alone are insufficient to meet the long-term outcome, particularly if working conditions are not optimal or if supply chain positions do not have adequate staffing or staff are not motivated. So I hope this picture and introducing these four elements helps you to have a much clearer picture of why we want to say that capacity development is not training, and hopefully you can now replace that thinking with this concept that through the People That Deliver theory of change, we can show you that there are four pathways that need to be consistently working in an organization to have optimized work performance: staffing, skills, working conditions, and motivation. I'm now going to go back to the chat and give you an opportunity to type in any particular questions or points for clarification. So if you could type these in now, we're going to have a quick look at a couple of the comments, but please move ahead and type in your particular questions. The point from Uganda happens in lots of countries where there are not full-time staff members in supply chain, but rather they are given the responsibility as part of their other work. There are some times where this makes sense, in which case we need to develop their skills, and they also need to have a productive work environment that we've described. But under the staffing pathway, one of the questions that asks is, are the right people doing supply chain in your country context? And are there enough of them? And so that would be the point that I would make in regard to Uganda's question. Thank you for the note about the technical issue with the phone. We will have this recorded to help with that. So what to do in an environment where people don't understand the need for workforce and where you need to have the staff required to act. So in this situation is a situation where we mentioned before, where the Ministry of Health or the organisation doesn't think that supply chain is important. So the first step here would be an advocacy approach. And this theory of change material, which is very graphic, easy to see, and also comes with a video, could be a good start to help to share with people the importance of a productive workforce to make supply chain happen. A little adage that I like to talk about when I'm discussing the importance of supply chain workers is if you had a toothache and you were in a lot of pain, who would you ask to deal with that health problem? Would you ask a doctor? Maybe, but probably not. Would you ask a nurse? Probably not. If you had access to a dentist, you would ask a dentist because they are a specialist. When we talk about supply chain, one of the interesting things is we often don't think that this is a specialized area. But just because you work in health and you're an expert in medicines doesn't mean you know how to run the supply system well, particularly at that managerial district level and above. And so it's needed that these people have the right skills. So in terms of advocacy, I bring you back to the document on People That Deliver website, the video, and there is also a particular video called Empty Shelves, Empty Hands from the Reproductive Health Supplies Coalition, which is a great advocacy video for the purposes of helping people understand that medicines are needed to improve health outcomes. And we have chance for another question before we move on, so please type in those questions. HR-related policy and advocacy interventions fall in the framework. So I'll come back to the picture to show you, but if you note, let me come back immediately to that and I'll show you on a picture. If I just go up to this picture, we said that one of the foundation principles is that the importance of the supply chain is acknowledged throughout the health system and positioned accordingly. So we would suggest to you that if the ministry or the organization you're working within does not take supply chain seriously, then you cannot implement this very well at all. And the first thing you need to do is work on this foundation principle, work at engaging with key stakeholders to help them understand the importance of supply chain and the importance of looking at human resources in that supply chain. I hope you find that helpful. And I've mentioned a couple of resources that you can use for that purpose. Just excuse me for a moment. I wanted to go to that particular slide in order to demonstrate that for you. Please keep typing in your questions because we will have some time after Michael gives us our summary shortly in order to come back to that. But I want to move on to talk about a couple other elements. And this speaks to your advocacy question. So the Human Resources for Supply Chain Management Theory of Change that People That Deliver has published can be used in a number of ways. In this discussion, we're talking about how to use it for advocacy, we've just discussed. So you can use it to help understand and convey that complexity. You can use it to explain the pathways of change. You can use it to advocate for the importance of investment. You can use it to design particular interventions based on a solid rationale to maximize impact and the use of your investment funding. And there are indicators associated with each of the pathways, which means you can plan and measure the impact of your interventions against the pathways to see if you're actually improving the pathways. So very measurable. And there is a tool that you can use that I want to introduce to you that you can use in a very simple way to assess the effectiveness of HR management systems. On the screen is a pictorial representation of the results of the tool. So there's a theory of change, a rapid assessment tool. The asterisk indicates that it's still being finalized. It's been trialed in some different countries by Global Fund, by GHS, EPSM, and People That Deliver partners. And basically what this does is get you to ask a series of yes and no questions around each of these 4 pathways, and then presents the results against what is optimal. It's very easy to use. It doesn't need a consultant. It needs someone who has an understanding of workforce and an understanding of the different elements that are described in the tool. And it can be done by individuals looking at their organization, or a series of stakeholders looking at a larger organization or country context. And what I call the spider web or the petal graph on the left, the colored area shows what has been completed and is being done well, and the white shows area of improvement. What this tool also does, if you look down the bottom, there is a series of tabs on the Excel sheet, is then highlights a series of interventions. So it can be used as a planning tool in order to say, well, for the areas that are weak or white, here is a series of activities that you can consider in your organizational context to undertake in order to create more color, or in other words, to improve those 4 pathways to have a more productive workforce. On the right-hand side are where the particular pathways are scored using a bar graph. This is just to give you an idea that it's very visual, and we find that when we're using the results from these assessments and we're putting the results before people who don't understand workforce very well, that this particular pictorial way of presenting the data is very interactive. And we have good evidence from Pakistan, Cameroon, and Kenya from our project where we've been using that. So I want to give you a couple other points about the tool. It uses this systems thinking to identify strengths and gaps based around the 4 pathways I've described. It can be applied to private sector, public sector, or a combination. It's valid for application at a specific level, for example, a central level, or it can be used at a combination of levels. It's flexible in methodology. It allows you to do a desk review. It can use as a self-assessment tool, and you can fill in the tool through a series of key informant interviews and maybe 1 or 2 focus group discussions. It's very light touch and can be done very quickly. In our context, project, we've done it within 2 weeks. A Global Fund, through People That Deliver, has been trialing an approach they found effective for a 1-week in-country situation. Very quick. And again, I just want to emphasize the visual nature of the results. We've been using the tool with People That Deliver for some time. They're still refining the tool, but if you would like to get access to the current prototype in order to have a look and a play and give us some feedback, then please send us an email and we would be happy to provide that to you so you can have a play with the current version. Again, I'll just stop for a moment before moving on to the Rwanda case study, just to see if anyone has any further questions they would like to ask at this point. Yeah, so the question is about keeping people in their position in the ministry when there are outside offers. This is called staff retention. And as part of this model, it discusses the need for having a staff retention policy and a career path and looking at different ways to motivate staff and keep them engaged. So this is a topic for which we have also done a webinar on that you may find helpful to go back to. I just want to give you a couple of high points about a case study that we did in Rwanda. I wish to acknowledge Erin Meyer, who was a consultant that we hired to do this work in Rwanda. So basically, we used the theory of change methodology and its associated indicators to work with Ministry of Health stakeholders to think about what are the elements required to optimize workforce performance in the Rwanda supply chain context, and what would be the HR strategy for that purpose. The background was that the government was briefed on the pathway, so we used the tools as an advocacy tool to explain to them that capacity development is more than just training and the different 4 pathways. We looked at an assessment methodology where we did, as I described, interviews, focus groups, and some site visits. And then using that material, we're able to find the gaps and look at the interventions to address those gaps. But then more importantly, particularly when you're looking for donor funding, is identify a series of indicators that could be used in order to measure the effectiveness of future investments. And that information was used to put a plan together. The overall steps that we took was step 1, identifying preconditions that are already developed. So where you have those 4 pathways, underneath each of those 4 pathways are approximately 15 of these preconditions or sub-elements that need to be in place. Because there are many, you can do a pre-survey to see where the strengths and weaknesses are. Did a workshop to make sure we're all on the same page, and we did a range of site visits to make sure we understood the context. We then looked at the baseline data, reviewed that data, and then with focus groups, we validated, agreed on the data, and then confirmed a prioritized intervention area. I had mentioned this quickly simply because this is a standard process that we all follow when we're doing assessments of different types. But in the Rwanda context, we're able to do this quite efficiently using the theory of change tool and come up with an agreed set of outcomes. Couple of we could spend time talking about different pathways, but just for Rwanda, I want to note that in the motivation pathway include this performance on management practices, effective supervision, ensuring workers understand their role, and workers for ownership. The data collection for this pathway was interviews, some site visits, and looking at evaluation reports and documentation. And this identified both strengths and areas for intervention. And graphically, it looked like this. So for the motivation pathway, after we reviewed the data, we noted that 10 of the 15 sub-areas were actually in place. This is the ticks. The stars were 4 priority areas that needed work on. So here we identified need to work on that poor performance is corrected, and that although a subcategory of workers have authority to make implementation, we wanted to work a bit harder on sense of ownership, understanding their role. And then down here, one of the key areas for intervention was that supervisors have the necessary skills to communicate performance. So this identified 4 key areas of activity and identified 4 clear action points that could be taken with a specific investment that we could then measure to see if the outcome was improved. So I'll get you to continue to type in your questions. I want to hand over to Michael in order to summarize what we've tried to present to you in this particular presentation. And then with the remaining time, I'll bring back your questions on the screen. Over to you, Michael.
Thank you, Andrew. Let me attempt to summarize all the things we've been talking about since. The first is for us to know that capacity development is a side-by-side progressive development of individuals and institutions, and that classroom training does not develop the individual entirely. Mentoring play a great role, where the mentor and the mentee, go on a journey where to actually do the work together over time to build the confidence and the competence of the mentee. Where we do carry out a training, we should please use adult learning strategy, where as we all know, the participants to such trainings are usually adults and they have their preference of learning. So we should endeavor to include role play, let the training be participatory, include group work, individual readings, and so on. And most importantly, that system strengthening is not delivering commodities to the warehouse and then leaving. It's far greater than that. It's more than that. Journey to self-reliance can only happen with good system strengthening. And this is, as Andrew rightly said, it's a long-term investment. And that capacity development can only happen with enabling environment. The environment just need to be conducive to encourage both the individuals and the institutions to develop. And most importantly, effective governance and leadership is the key. So, yeah, so next slide. Here, the project, PSM project, workforce development tools and resources, just to introduce you folks to this. Some of you may already be using them. One of them is the Workforce Development Technical Approach 2-pager. We have the People That Deliver Theory of Change Rapid Assessment tool. We equally have the Supply Chain Management e-resources summary. We have the bi-monthly webinar, which we are all involved in doing right now. And then we have the quarterly resources review via the International Association for Public Health Logisticians. If you are not already a member, please do join to access these resources in the IHPHL. Again, coming back to the summary, can you go up, Andrew? Okay, coming back to the summary, the takeaway. No, the one down, one more. Okay, coming back to the summary, the takeaway, capacity development focuses on the individual and the institutions, which must go side by side. And when we do conduct training, we should please consider including all the adult learning techniques into the content of the training. And that training alone will not liberate the individual or liberate the system. It will be some investment that will take care of the immediate, but with time, we'll recede back again to baseline. In other words, no progress made. So for progress to be made, the side-by-side progression of development of the individual and the institutions cannot be overemphasized. If we have any comments, any questions, please feel free to type in. We want to have all of them.
Thank you, Michael. Bring up, sorry, if you want to make a comment on this slide, and then I'll bring up any remaining questions for the time we have. Back to you, Michael.
Okay. Just to, if you have any information and you want to send us a mail, please, the email addresses are on the screen, and we'll be very happy to respond.
Thank you, and let's see what other questions you may have available. I hope that as participants on this webinar, you now can clearly go away and understand that health supply chain capacity development is not just training. And hopefully we have equipped you with a framework that helps you to discuss with your peers and your supervisors and other stakeholders elements that you can discuss in order to open up further a systematic approach to human resources using the theory of change. Michael, back to you as we look for any closing questions.
Yeah, right now we're scrolling to see if we have any question. Please type in if you have any question, if you have any comment that you want us to revisit while we still have the time.
Yeah, please, you're very welcome. Any particular question, comment, or feedback you'd like to provide, please do so. This webinar has been recorded and we will put it up on our YouTube channel as soon as we can. Michael, we've stumped them. No questions. I don't believe it.
No, they are thinking. They will, well, even after the session, they can still send questions. The emails addresses are given to them.
And also a reminder, if you'd like to get a draft version of the People That Deliver Rapid Assessment tool, please send an email to Michael or myself to be able to do that, because we'd love to get your feedback.
Yeah, we have a question from Peter. It's not, I think, please elaborate more. Okay.
Yeah, go ahead, Michael. That's it.
Yeah, I'm looking for it now. Okay, can't find it.
Okay, so it looks like we've exhausted you, everyone, with terms of your questions. On behalf of the USAID Global Health Supply Chain Procurement and Supply Management Project, both Michael and I would like to thank you so much for giving up an hour of your time to participate with us on this webinar. We hope you have found this a valuable investment of your time, and we will be making this material available, and you'll be able to get access to the resources that we've described as well from this webinar. We would all like to wish you well as